Hi, everybody. Someone on a recent video of mine posted in the comment section asking about which essential oils I like to use the most for pediatric patients. I had mentioned in a recent video that for my own kids and for my pediatric patients, I'll recommend using topical essential oils to help treat viruses, because at the end of the day, essential oils are really great systemic antimicrobials, but it's just quite tricky to get them into children orally, because of course they're really caustic and kids usually can't swallow pills, and it's just very tricky. So as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So for my own kids, and typically what I recommend for my patients, I really like frankincense essential oil. It's just a great broad spectrum antimicrobial. It has great anti-inflammatory properties, and typically I'll recommend either applying that directly, oftentimes to the soles of the feet, but it could be applied to other parts of the body, or mixed with a carrier oil. I'm sorry I can't talk about specific dosages because it's just I'm not allowed to give out anything that could be construed as medical advice over social media. So please don't ask about dosages in the comment section. Please talk to your healthcare provider about getting the right types of dosages and dilutions and this and that. But frankincense essential oil is one of my favorite topicals to work with. I'm also a really big fan of diffusing essential oils into the room where kids are spending time. Oftentimes in my household, the kids are bouncing from one room to another, one level of the house to the other, playing in the basement, playing in the playroom, which is on our main level. And so during the daytime, we don't really do a ton of diffusion. I mean, in the past, when one of my sons had a pretty nasty respiratory infection, we were running it during the day. It's like camped out on the living room couch or wherever it was, and we're running the diffuser there too. But usually I usually just run it at nighttime, but it could be run during the day too. But I like to use fairly high dose essential oils in the diffuser, in a contained space, in a bedroom or whatnot, or in a room with doors that can be closed to kind of keep things contained, because if you're just running it in the middle of a main floor that really open concept kind of place, then it's probably not going to build up in a high enough concentration to be meaningful for the amount that we breathed in. Now, one thing that's important to note is that for those of us who have furry friends, i.e. pets, to my understanding, essential oil inhalation is not safe for certain animals. I don't have any pets. My kids keep me busy enough. But what I understand from information that's out there, not all essential oils are safe for all animals, so just being aware of that. And I tell my patients, or advise my patients, like, if you have pets, talk to their vet about what's safe to inhale, because I don't know. It takes up enough of my brain power treating humans. I really don't know how to treat four-legged creatures. So the topical frankincense, and then diffusing either frankincense, or I personally like diffusing peppermint essential oil. I just think it smells really nice. My wife finds it's a little bit overpowering, but I think it smells great. And peppermint has great antimicrobial properties too. All essential oils do. Although interestingly enough, they have done a number of petri dish studies looking at the potency of essential oils against a range of different microbial types. They've actually done a handful of studies specifically looking at essential oils against the Lyme disease causing bacteria, Borrelia burgdorferi, in petri dishes. But nonetheless, they've basically showed that a wide range of essential oils all have antimicrobial properties, but some definitely do work better than others. So it's not to say they're all created equal for the antimicrobial benefits. I do also like using thyme essential oil, either topically or diffusing that. So frankincense and thyme would be kind of at the top of my list. They have they pack a wallop for antimicrobial properties, and so I really like them. And then I do like the peppermint as well. But oregano is great too. Cinnamon is great, although cinnamon is very expensive in terms of as an essential oil, so I probably wouldn't diffuse that. Or I mean, you go to the ends of the earth for your kids. You can put some drops of cinnamon essential oil on them if they needed it. But I actually, quite frankly, I've never used it topically, either personally or I generally always try things on myself first. But I'm not sure how topical cinnamon would feel. I personally probably wouldn't use topical peppermint essential oil because it's just such a if anyone's ever used something that's like a muscle rub or something that has menthol in it or whatnot, it's kind of packs quite a punch too. So be something to be diluted probably more than certain other oils. Anyways, I hope that this answered the question. If anybody has any questions about this topic or anything else, just post in the comment section below and I will answer as soon as I can.